we pretty much still base it on histology. And I think maybe my practice reflects the community a little bit more than, perhaps more than Ross's, but if they've got a non-squamous, pretty much an adenocarcinoma, we'll routinely test for EGFR mutation, ALK translocation, and because we have studies targeting at KRAS, not that it's actionable yet, but simply because studies do exist, and it still is a quarter of the entire pie when we look at adenocarcinoma. And then we do second-tier testing. So if those three are negative, and lung has its triple negative now, just like breast, we'll look at ROS1, at BRAF, HER2, and increasingly RET.
So we have a multiplex assay, so we have the snapshot assay, so we don't have to do the tiered testing. And certainly for adenocarcinoma, we do the snapshot assay, which will give us EGFR and KRAS and BRAF and PI3 kinase. We have a sizing assay for HER2, because it's mostly insertions. And we do ALK and ROS1 FISH. We actually have a dual FISH assay, so we get both at the same time. And then we default to RET testing, which is a research assay for pan-negatives.
So it's all done simultaneously, or is the RET reported out separately?
The RET comes back later, because that's still currently a research assay. The principle is, you can do the testing for stuff that you think there's something you can immediately action. I think RET, we all think that's the next thing to come along, but because it's not there yet, you can't really bill that to somebody. Right. When it's part of a multiplex mutation, they're all bundled together, but the FISH is a definite distinctive test.
What's the turnaround for the
FISH testing is about 4 days. The mutation testing is probably close to 10 working days.
10 still, yeah.
I don't know about you, but the sort of elephant in the room is the biggest thing is it takes you to get the block from an outside institution in.
Same problem. It could be 3 days, it could be 3 weeks.
Yeah.
And there's no uniform theme when it comes to getting these blocks or getting the slides from the blocks. We're about to get going with a platform similar to yours, but I think even in academia, it's a minority of institutions that are really doing the immediate multiplex testing that Colorado, I guess, has been doing for quite a while.
Yeah, well, it came in as part of the Lung Cancer Mutation Consortium, but I think there's a big push to do it from a health economic point of view, because when you do an individual test, the cumulative cost is actually more than just going and doing them all.
Not to mention the inefficiency in tissue depletion.
Yeah.
So I agree with you, and I think ultimately, from the standpoint of convenience and really from the standpoint of truly characterizing that tumor as best we can with the limited number of mutations that we can find, that it's going to be much more efficient to do it all at once. I still worry that this sort of technology is not going to be routinely available in the community, and they'll either be sending it out to academic centers or to a number of commercial consortiums that exist.
I think there are a number of commercial companies who recognize the need, and they're trying to make it easy. Take the thing, stick it in a FedEx envelope, and we'll send you the results back in a couple of weeks' time. And I think that's coming.